Hello, my name is Mike Seyman. I'm one of the pediatric nurse practitioners here at Cumberland Pediatric Associates. We are kicking off an educational video series today. The first video is going to be on Tylenol and Motrin dosing. Now, Tylenol is acetaminophen. Tylenol is just the brand name of acetaminophen, and Motrin is ibuprofen. It's the brand name. These medications are safe to give when given as directed in the right amount, in the right increments of time, and that's what we're going to talk about today. Fever is one of the main reasons we typically give these medications, as well as for pain relief. When thinking about fever and thinking about these medications, we do not want to give either of these medications to any child under 2 months or any child who has not gotten their first round of vaccinations. This is because some of the infections that can happen under 2 months are very, very serious. And if we're giving Tylenol, we may mask a fever, and when the temperature would have gone up, and we wouldn't have known as soon about the infection. And infections under 2 months are a big, big deal. So we want to avoid giving either of these medications under 2 months, and we want to avoid giving ibuprofen under 6 months in general, because it can have some harmful effects to the stomach and the kidneys. So with that in mind, I'm going to put up two charts here. One is acetaminophen or Tylenol, and the other is ibuprofen or Motrin. These are going to be on the screen as well as below this video in a link that you can refer to. In pediatrics, we dose things based on weight and sometimes age, but in this case, weight, and you can see where your child's weight, their most recent known weight, would fall on this chart, and you can safely give that amount of the medication. Typically, these medications will come with either a syringe like this one that has different increments on here, 1.25, 2.5, etc., or a little medicine cup that will have little lines that you can safely use. We only want to give Tylenol every 4 to 6 hours in the proper amount, as you will see on the chart, but not more than 5 times in one 24-hour period. And ibuprofen we can safely give every 6 to 8 hours, not more than 4 times in a 24-hour period. One other important thing to note is that there's only one liquid concentration of Tylenol on the market. It is 160 milligrams of medication in every 5 milliliters of liquid. So that there's only one on the chart there. The other are other forms of the medication like dissolvables or pills. Ibuprofen still comes in 2 concentrations, one being 50 milligrams in every 1.25 milliliters, sometimes it's called the infant dosing, as well as 100 milligrams in every 5 milliliters. It's very important to know which medication you have. It will be listed on the bottle or on the box. I would refer to the bottle, and it will tell you which concentration you have. It's very important to know that because, as you can see on the chart, they are different how much you should be giving. So you want to know that, which bottle and concentration you have. It is also always okay to call our office at 615-453-1252 if you have any questions about how your child is acting, how much medication you should be giving them, which medications are safe. We are always here for your questions. Something else I like to talk about is the over-the-counter medications like the cough, cold, flu medications. These are safe to use as directed on the box, generally over about 4 to 6 years of age. However, oftentimes they will have combinations of medications in them, including something like acetaminophen or ibuprofen. Therefore, you need to pay close attention reading the box with the ingredients to make sure that you're not giving a medication like that as well as a dose of acetaminophen at the same time or within 4 to 6 hours, because that is a recipe for giving too much acetaminophen or ibuprofen at once. We want to avoid that, so we need to make sure that we know what's in these cough, cold, flu medications before we're giving them, and if we're going to give them, not giving a dose of acetaminophen or ibuprofen by itself at the same time or within those 4 to 6 hour windows. Thank you for stopping by and learning a little bit more about Tylenol and Motrin. As I said before, please don't hesitate to call us at our office number if you have any questions about these medications or anything else. And we are going to have more videos on the way shortly, and we look forward to talking to you guys in the comments. Thank you.